And then let's do pickups really quick.
Pharma concerns, take 2.
When I'm behind the pharmacy counter, it's incredibly common for people to come up and ask me questions about UTIs, and I'm sure the same for you in your practice. So let's tackle some of the most common questions that we get asked. So to start out with, are there different types of urinary tract infections?
Yes, there are 2 different types of urinary tract infections. There's a lower urinary tract infection, which includes the bladder and the urethra, and those are not as serious and get usually treated with antibiotics. Within 24 to 48 hours, you should see improvement. And then there's upper urinary tract infections, which includes the kidneys and the ureter. And usually it stems from a lower urinary tract infection that's not treated that becomes an upper urinary tract infection. And those are more serious, and you really need to talk to your provider, make sure you're on the right antibiotics, and you may need more diagnostic testing. So those are the 2 major types, and it's really important to understand the differences.
So what's our next question?
So our next question is, can men get urinary tract infections?
Oh, that's a good question. So yes, men can also get UTIs. They are more common in females because of their anatomy, but in men, UTIs are more common with men who have penetrative sex that's unprotected, or in men who are uncircumcised and don't practice good hygiene. Those can introduce bacteria into the urethra and make UTIs more common for men. So our next question is, will I have my UTI forever?
So if it's treated, you will not, because you shouldn't have a UTI for more than 48 hours being treated on antibiotics. You should see a difference and should see your symptoms resolve, but you do need to finish the full course of antibiotics to make sure it's treated, because if you don't, then it could be recurrent. Or if the antibiotic's not right, that's another reason why you may still have symptoms after 48 hours. That's the only reason why you would have it lasting more than 2 days.
Perfect. What's our next question?
So our next question is, do I need to take an antibiotic?
Good question. So in about a third of cases, if you have a mild UTI, you might be able to get away with not taking an antibiotic. You might be able to hydrate and flush your system, and your symptoms should go away in about a week. But if you want fast relief and proper relief, we recommend taking an antibiotic. And they usually start working within 1 to 2 days. Your symptoms will go away. But as you mentioned, and this is a recurrent theme, you need to take your antibiotic until it is gone. That's the only way to make sure your UTI won't come back. And you also don't want your urinary tract infection to become a more serious kidney infection. So getting fast treatment is really important. And our last question, and this is an interesting one, is apple cider vinegar good for my UTI? And I hope they're talking about drinking it, but
Yes.
we'll cover both, right?
Yeah, well, there's also about douching and drinking. So in both cases, the data has shown that it does not help. And you can actually cause more harm than good. So talk to your provider of getting the proper treatment, which is antibiotics if you have a urinary tract infection.
Yeah, the only home remedies we really recommend are a heating pad for the discomfort. That's about it. Otherwise, you need medicine.